Okay, I'm gonna walk in, I'm gonna wash my hands, I'm gonna provide patient privacy. Hi, my name's Riley, I'm gonna be your student nurse today. Can I have you verify your name and date of birth for me? Perfect, I'm gonna check the wristband, make sure I have the right person. I'm gonna do a quick safety survey. Your bed's lowered, there's no fall hazards, you have the call light within reach. So I have an order from the physician to do a clean dressing change today. So while we're doing that, I'm gonna measure, and it might be a little uncomfortable or cause pain, but I just want you to let me know if it does. Can you tell me if you have any pain currently? On a scale of 0 to 10, 0 being no pain, 10 being the worst pain of your life. Okay. So now I'm going to wash my hands, make sure I have all my equipment. I'm gonna put on gloves. Okay, and I'm just going to expose the only necessary parts of my patient. Okay, I'm going to pull off the dressing using the push and pull method to minimize discomfort for my patient. Okay, I'm going to look at the top dressing and make sure there's no virulent drainage or odor, and there's not, so that looks good. And I'm going to pull out the inner dressings. There's also no drainage or odor, so that also looks good. Gives me a good sign there's no infection. I'm going to discard that. I'm going to look at the surrounding area. It's only slightly red, which is to be expected. There's granulation tissue, and it's beefy red, which tells me that the wound is healing. There's some muscle visible, and no drainage inside the wound, so that tells me that there's no infection present. So I'm going to measure really quick. I'm going to measure my length of my wound. It's about 14 centimeters long by 2.5 centimeters wide. I'm going to do my depth. Okay. By 2.5 centimeters deep. So I'm going to discard that. I'm going to take my gloves off, wash my hands. Okay, and now I'm going to prep my supplies for cleaning the dressing. Tape now too, so I don't have to do it later. I'm going to clean my hands again. Put on my gloves. going to clean my wound. So we're going to clean middle first from top to bottom. Scarred. We're going to clean outside wound. Scarred. The other side. Outside. Here. I'm gonna do one more just to be sure. Okay. I'm going to take off my gloves again. Wash my hands. New gloves. Okay. Now I'm going to take my gauze and my cotton swab, and I'm going to pack the dressing, making sure it's not too tight, but enough to where it won't come out. Okay. Discard that. Grab my top dressing. Put that there. Tape it down, making sure not to get any pubic hair, and making sure there's no wrinkles in the tape to make it as comfortable as possible for the patient. Top ones. Okay, cover my patient up a little bit. I'm gonna take my gloves off. Wash my hands. And I'm going to date an initial 2/26/25. Okay, I'll put that there. And then I'm going to document that I cleaned and put a new dressing on the wound on this date, 2/26, and that there was no sign of infection. And then I'm going to cover up my patient, make sure that they are comfortable and that they're feeling okay, and then I'm going to tell them that I'll be back in a little bit to check on them and make sure everything looks good.